Hi, Dr. May again, Mini Health Talk to get you healthier again. Today we're gonna talk about Goiter herbal therapy. So before we talk about how to treat goiter, so we need to know the causes of goiter. In the old time, mostly in the mountain area, Asian or Africa, people could be lack of iodine in the diet, but it's pretty uncommon in U.S. because we have a iodine salt, so we have pretty much supplies. So some of causes like low thyroid hormones forces the thyroid to grow bigger to produce more thyroid hormones to meet their need. So there are also unknown reasons or the drug-induced goiters like lithium, that's for the emotional disease. So what are the risk factors? Risk is hereditary. So if you have family members who have goiters, you're more likely to have it, especially your parents. B is a female gender. Okay, female somehow after age 40, their hormone kind of imbalance. They have decreased sex drive. More often they have easier have goiter. They're over age 40. That's another risk factor. Thyroiditis. So somehow your throat infection induce the thyroid inflammation. That's why I like the patient to use Listerine to soak their mouths each night before they go to bed to avoid those happenings. Radiation exposures, those people whose work are related with radiation, more often they easily have goiters. Graves' disease, pregnancy, when you're pregnant, your hormone change dramatically. That could cause temporary goiter. Those usually it's easy to treat. Sometimes you don't even have to treat it. They can heal by itself. Hashimoto disease. Okay, next slide, please. So how to diagnose it? Diagnosis is easy. You just put your fingers over your thyroid level. You swollen the salivary. So normal thyroid, you can feel it, but if you swollen, you can feel nodules on it. That's a goiter. So usually benign goiter should be soft, roundish, and malignant ones usually is kind of firm, irregular, and plus benign goiter, when you touch it, it don't have any discomfort. The malignant gland, when you touch it, it could cause some aches and discomforts. Okay, next one. So you can also do some MRIs and iodine studies on it. So to talk about a goiter therapy, we need to talk about the hormonal triangles. Hormonal triangle is so in our body we have three hormones: sex hormones, adrenaline, and the thyroid. These three hormones have to be in a dynamic balance for this hormone for our hormonal system to function normally. So usually your sex hormone is measured by how often do you have sex. Usually if you have sex once or twice a week, your sex hormone should be normal. But if you have sex hormone way less, that means your sex hormone is very low. Any hormone low or high could cause the other two hormones to out of whack too. So the other is the adrenaline hormone. Adrenaline hormone is like just almost like your stress hormones. So when you are stressed up, you exhaust your adrenaline hormone too much, it causes a lot of fatigue. When the adrenaline hormone is low, they can also make the thyroid hormone low. Thyroid hormones control metabolic systems. So these three hormones are in the dynamic balance. So you have to make sure to do something to increase your sexual activity, reduce your stress level, to help the thyroid hormone too. Okay, next slide. So Chinese herbal therapy in Shanxi, typical formula we use 柴胡 10 gram, 川芎 10 gram, 陈皮 6 gram, 夏枯草 15 gram, 白芍 10 gram, 枳贝母 15 gram, 椴母栗 20 gram, 炙甘草 6 gram. It's mainly the focus mainly try to disperse your liver qi. So that's the later I'm going to talk about it too, and try to shrink the goiter. So in the patient in the mountain area, we usually can add 海藻 and 昆布 to add some more iodine into it. For the fast-growing goiters, so if you feel like your goiter grows too fast, we use 三棱鹅煮 to break the we call that break the bad blood, so that they won't grow that fast. Okay, next slide, please. So when you have goiter, there's do's and don'ts for you to follow in conjunction with acupuncture or Chinese herbs to make it heal faster. The do's is to, number one, you have to reduce your stress by positive thinking. When you have less stress, the chance for your goiter to get worse become lesser and less. They can almost return to normal. Number two is increase sexual activities. Have sexual intercourse at least once a week to balance the hormones. When you have sexual activities, your sex hormone retain in the normal level, they will help the thyroid hormone too. When the thyroid hormone is normal, they don't overgrow to compensate. Okay, number three is eat more saltwater fish or shellfish. Those are help you to iron metabolism. Eat more dairy products, eat more soy products, and more sunshine. More sunshine create more vitamin D. They help the thyroid level too. Okay, next one. Don'ts. No working pressure. How can you have no working pressure when there's so much pressure on you? You have to fully in love with your work. Figure out a way to fall in love with work. If you don't love your work, almost like you marry a husband or wife you don't love, but you live together every day, that's horrible. Is that right? The other thing is no wine and no smoking, or no spicy food. Those are the stimulants that could make the goiter grow bigger. Okay. The third is try to avoid Brussels sprouts, cabbage, cauliflowers, kale, turnips, and bok choy. Why you shouldn't eat too much of those, or try to avoid eating those? Because some studies show those they prohibit the thyroid to absorb the iodine, so that's why you should avoid those food. Okay, next slide, please. Okay, I want to thank you again and to spend time with you to learn the health knowledge to get you healthy again. If you like my program, please thumb up. If you want more to come, please subscribe to our channel. Thank you again. We'll talk to you next time.